good. Hi, kiddo.
This is Moby.
Hi, Moby. Gosh, look at him. He does not want to budge, does he?
No, he doesn't.
All right, so we're here to talk about getting Moby neutered.
Yes.
It's that time in a young cat's life, huh?
Yes.
All right. Have you been through this before with a kitty?
Not with like my own cats, but I've had cats growing up, but I've like been there.
Okay, sure. No, I understand. Yeah.
Yeah, but no, not like with my own cats, no.
We all grow up and we all have to go through it ourselves, right? That's okay. All right, very good. I'm so sorry. I thought I recognized your face, but I'm Dr. DeStefano. I guess we haven't met before. Nice to meet you. All right, so why don't we say hi to Mr. Moby? So for the boy cats, kind of get off easy.
Okay.
I'm sorry.
Yeah,
there we go.
Good.
Hey, oh, I got you. I got you. Okay. You are very fluffy. Did we get a weight on him yet?
I did.
You did. Okay. So the boy kitties kind of get off easy. It actually takes longer for us to sedate them than it does for the actual procedure on average. So barring anything really, really unforeseen, the procedure itself is only about 90 seconds, and that's if you're a little slow, to be honest. That's if the surgeon's a little slow that day. Didn't get their coffee early enough. Couple of small incisions. We don't even put any suture in there, any stitches for the most part, so they don't even have the small risk of reacting to that. And then we kind of just let them wake up naturally, to be honest. The benefit of such a quick procedure is that we use a couple of really benign pain medications, like a weak opiate kind of meds, and then a reversible sedative. So if we need to, if there's any complications with the sedation, we can pop them with a second thing, and it actually takes it out of their system, which is really helpful.
Awesome.
And then if needed, we put them on a little bit of gas, but usually that's not needed.
Okay.
Okay. So the main things we get concerned about is the functioning of the cardiovascular system. Heart and lungs sound very good on the left. And the right.
Very polite.
What's that?
It's very polite.
The cat?
Yeah.
Oh.
Well, you are too.
Oh, thank you. Got nice strong pulses in the back. He's got a little bit of fur matting on his belly.
Yeah, he's got tons of matting.
Might be time for a trim,
Yeah.
Oh,
You're,
yeah.
you're neglecting yourself there.
Are we comfortable doing babies at the time of surgery?
Yeah, that's all right. Yeah, we can do that. Very good. Everything feels great in his abdomen. Take a look up there. Up here. Hey, bud. Now, what do you think, huh?
This is weird.
Very good, kitty.
Get some shit.
Yeah, I'll go ahead and do that. And so you're already probably aware with him that he's got that pretty deep skin fold on the other side of his nose.
Yeah.
It does look like he's getting a little bit of irritation on the inside of there.
Yeah, we try to clean it twice a
Yeah.
day with the
And
hot
that's-
compress.
It's probably going to be a lifelong
Yeah.
issue with him. If it becomes a really difficult issue, if he's starting to get infections, we may be able to surgically kind of trim some of that extra tissue away to make that divot a little less pronounced, right?
Okay.
Not something that I would necessarily jump to on a young cat, but if it winds up being a huge issue, you know,
I'm gonna let
it
him
wouldn't be a
relax.
bad thing. Absolutely, he can go hang out. I think I'm all
I'll put
done
him in
with
his
him.
carrier for now, just in case I'll bring him to treatment to get some fluid. You did so good.
He's a great boy.
Okay, okay. There you go, kiddo. Good job. That's funny.
So the risks and benefits of doing this on a male cat. The boy cats are really one of the few species that we talk about having really big, actually behavioral avoidances when it comes to neutering them. So so obviously they don't prowl around looking for friends, right? Female friends, and they don't make as big of a mess in your home. So you know, cats will definitely mark their territory. So we avoid that almost completely, and if we neuter them. Otherwise, we are avoiding accidental pregnancy and you know and things like that. That's especially with cats. It's a big concern in this country. The risks are pretty minor. Again, you know, we do use medications. An animal can react to any drug that we do use. But it's a reversible sedation, really low dose of pain medications. and it's a really quick procedure. So his overall risk factor, definitely the pros outweigh the cons, especially for most of these procedures, but definitely for the boy cats. Let's see, I think that's just about everything that I wanted to talk about. Do you have any questions?
So I was reading online because I'm in a bunch of Persian cat health groups on Facebook.
Okay.
And a lot of the people are against the rabies shot because they say that the cats are prone to getting like sarcomas, like where the injection site is. Have you guys seen anything like that?
So that
I'm
is.
just like, because of his breed, I'm just a little paranoid.
So
about
I'm not aware of any specific breed predilection.
Okay.
Gosh, I forget the numbers, but it's like a 1 in 100,000
Okay.
chance. And it isn't, as far as we can tell, it isn't a vaccine site sarcoma,
Okay.
it's an injection site sarcoma.
Okay.
So literally any injection with any medication could
do it.
potentially cause one,
Okay.
yeah.
So same risk as anything else.
Yeah,
pretty much. Okay.
correct. Yeah, so same risk as any injectable medication that we could use. In addition to that, the numbers that we have, the likelihood of an animal experiencing a problem with it is far outweighed by the number of animals and people whose lives are saved by performing the treatment. So
Okay.
I like to say that nothing I do in this building is benign.
Yeah.
Way has a risk factor, but
Yeah.
we're always weighing pros and
Okay.
cons. And that's a really good question. It's definitely a risk, especially in the cats,
Right.
but it way outweighed by the pros, I would say.
Okay.
Cool, awesome.
all I had.
Awesome, yep, no problem at all. Okay, very good. Well, very nice to meet you.
Me too.
Very good, all right.
He's a good boy.
Let us know if you have any other questions or anything, but otherwise we'll see you on the day of.
I'll go ahead and borrow him for some more work if you don't
Okay.
mind.
Yeah.
I'll take him to treatment. Okay.
Cool.
He likes
All
to
right.
look at things.